and performing other pulmonary function tests. Technologists, medical technicians, and paraprofessionals. Diagnostic personnel work in the laboratory and radiology departments. Their roles involve assisting the medical professional staff in testing for disease states and injury. The term technologist refers to those who have a bachelorate degree, whereas the term technician refers to those who have had training and have earned an associate degree or certification. Paraprofessionals are educated to assist the professional in providing care for patients. Unlicensed assistive personnel are educated in basic nursing techniques and perform under the supervision of the RN. The unit secretary prepares and maintains patient records, other supplies, schedules tests, and performs receptionist. The unit secretary prepares and maintains patient records, orders supplies, schedules tests, and performs receptionist duties in the care unit. These are only a sampling of the healthcare participants in the healthcare system. Each participant has a valuable contribution to make toward ensuring the safe and well-being of the patient. Economic factors that affect health and illness. Rising healthcare costs. Healthcare costs have reached a critical height. A large portion of the country's financial resources are committed to healthcare-related costs. Several factors have been highlighted as playing a role in the increase of costs, including an aging population, increased use of advanced technologies, rising costs of private healthcare insurance, the rising costs of medical malpractice insurance, and a struggling economy. Increasing number of aging Americans. As the baby boomers generation nears the age of retirement, their health problems increase. This onset of chronic diseases in a large segment of the population strains the healthcare system. Diseases associated with aging include heart disease, diabetes, and osteoporosis. As the U.S. population ages, an increasing number of the older adults need nursing home care, which is costly and has limited coverage under traditional insurance plans. Advances in technology. Advances in technology have led to better diagnosis and treatment of illness, but such progress carries a large price. Research and the development of technology costs millions of dollars, a price that is passed on to the patient in the cost of the individual test or treatment. Technological advances have resulted in concerns for patient privacy as electronic piracy has become an increasing threat. Safeguards for the electronic health records add to the cost for the healthcare. Healthcare insurance. Private healthcare insurance initially was developed to defray some or all of the costs of healthcare. It made healthcare more affordable, but it also raised the demand for it. As more individuals sought care, the price of the healthcare services and insurance costs spiraled. This trend continues at an alarming and seemingly uncontrollable speed. The underinsured and the uninsured populations face hardship when healthcare is needed. Determination of who receives care and who does not is becoming an ethical issue at all levels of the healthcare delivery system. To further compound the current economic problems, nearly 16% of Americans, or 48.6 million people, are without healthcare coverage. Although this number has declined for the first time in several years, it is still a cause for concern because these individuals too often avoid preventative and routine care and are seen only in crisis situations. Malpractice insurance. Nurses and doctors carry medical malpractice insurance to protect themselves in the event a malpractice claim is filed against them. As malpractice claims have increased in frequency and amount, the premiums for this insurance has also risen. In response, physicians sometimes resort to practicing defensive medicine. That is, they become overly cautious out of the fear of a claim, ordering costly tests and procedures not because they are medically necessary, but to protect themselves. These behaviors have resulted in higher medical costs for the patient. These issues are alarming for healthcare providers. Nurses can help keep costs to a minimum by using materials and time economically and providing knowledgeable, efficient care. Changes in delivery system. Hospitals throughout the United States are changing delivery systems to make care most effective. Case management and cross-training are two commonly encountered methods of modifying the systems used to deliver care. Case management nursing revolves around the use of clinical pathways, which map out expectations of the hospitalization according to a designated time frame. The RN functions as a case manager, coordinating and planning care of a group of patients or caseload. A LPN/LVN works with the RN to assist the patient in attaining desired outcomes of care. Case management nursing has been proven to reduce the length of stay for the patient, which in turn reduces the overall cost of the patient's health care. Cross-training allows employers to maximize the use of available staff. Workers are trained to perform duties that cross traditional role boundaries. Cross-training may involve combining the roles of different categories of workers or expanding the responsibilities of staff members to cover multiple care units. Two groups of workers that frequently cross-train to expand their roles are clerical support staff and UAP. This training enables a single worker to perform UAP-related tasks, ambulating patients and taking vital signs, as well as clerical support duties like transcribing orders and ordering unit supplies. Another type of cross-training involves linking patient care units, frequently identified as sister units. Common sister units are maternal, child, and women's health, and the nursing staff are trained to work in both areas. Individuals receive training to perform duties that vary according to the needs given at a time. This training can be as narrowly defined as medical training to care for surgical patients, or as broadly defined as housekeeping personnel training to give basic morning care to patients. The scope of cross-training usually is defined by the individual institution, and the purpose is to reduce the number or cost of employees without compromising the quality of patient care. Other trends that affect the economics of healthcare include the development of multi-system healthcare chains or networks that may include several hospitals, clinics, nursing homes, and pharmacies. These systems share expenses and generally achieve an overall reduction in operating expenses. Health maintenance organization, HMOs, or group healthcare practices provide health care to members for a fixed prepaid rate. This service includes medical care, nursing care, diagnostic tests, hospitalization, and various inpatient and outpatient treatment. This service has shown a high quality of low-cost health care. Social and environmental factors that affect health and illness, but they do influence the development or progression of an illness. Financial hardship, lifestyle choices, and social pressures all influence an individual's willingness or ability to actively maintain health or prevent illness. In addition, personal behavior choices such as smoking, drug abuse, alcoholism, and obesity affect an individual's health and wellness. The individual's mental state has an influence on patient outcomes. Emotions associated with fear, loss of identity, and loss of control commonly are experienced during illness. An imbalance in body functions can affect one's physical condition and ultimately the position along the wellness-illness continuum. Although there is often a tendency to separate social factors from physical factors, remember that the two areas affect each other reciprocally. Each patient possesses a unique personality, background, lifestyle, and level of education. Early recognition of the effect of the environmental factors on a patient and prompt intervention by family, healthcare providers, or the patients can decrease or minimize any negative impact. Health promotion. Most people in the United States believe that everyone has a right to health care, regardless of race, color, creed, or economic status. This health care includes the treatment of the disease and health promotion and preventative medicine. In many cases, treatment of illness is less of a concern than its prevention. The acute awareness of preventative medicine has resulted in today's emphasis on education about issues such as smoking, heart disease, drug and alcohol abuse, weight control, and mental health and wellness promotion activities. During illness or after a change in health status, people often feel they are not in control of their health system, but they typically do trust in the healthcare system. The presumption is that care will be highly satisfactory and lead to a cure. Healthcare providers are expected to provide services in a knowledgeable, safe, and an expeditious manner, and to work in a cooperative manner for their benefit. Patients also expect the cost of care to be reasonable and, most importantly, paid by someone else, an insurance company or the government.